3 months ago, on March 7th, I gave birth for the first time at 9:45 a.m. to our son, Landon James Long, and this is how it all went down. So I'm going to talk about my pre-labor, my labor and delivery, and a little bit of my postpartum. So to start with my pre-labor, I thought I was going to go early. I was so sure that I was going to go early, and so was everyone that I knew. Everyone thought that by 36 weeks, people said, oh yeah, you're going to be 2 weeks early, because I was massive. He had dropped a lot, so he was really low. You could see that my hips were bigger and everything. So by 36 weeks, I was going weekly, and then by 38 weeks, I got my first stretch and sweep. I was really excited. I was hoping that was going to kind of kickstart things, because I was so done with being pregnant, and I just wanted to have my baby. So after my first stretch and sweep, nothing really ended up happening. I bled a little bit that day, and that was kind of it. But then the next day, I lost my mucus plug, which was really exciting. I was like, okay, since I've lost that, that means, things are going to start happening in the next few days. I'm going to have my baby early. This is fantastic. Well, nothing happened, of course. So that was really disappointing. So then the next week I got another stretch and sweep. I think the day after that I did have some contractions, real ones. I'd been having Braxton Hicks since about 36 weeks, but I had some real contractions. I had to stop, take a breath sometimes, but it didn't progress at all, and didn't evolve into anything. So I was trying everything at home to make this happen because I was in so much pain. I tried everything in every video that you could find on YouTube, and nothing worked. So my due date was March 1st, and I had an appointment just before that. So we said, okay, let's schedule an induction. So we scheduled it for March 7th, which was great because I really didn't want to go over 41 weeks. We checked and I wasn't even a full centimeter dilated, so we knew things weren't really progressing, even though I was in so much pain. Because I was in so much pain, by 38 weeks I had stopped working because I work on my feet, and I kind of thought I was going to get to have a bit of, nice time off, but those 2 weeks were awful. It was just filled with me impatiently waiting to go into labor. I couldn't really do much. I couldn't sleep a lot, which sucked, and I couldn't really do any activities because I couldn't walk around too much. I think I saw a girly movie with my mom, and that's probably the only fun thing that I did in those 2 weeks. And then another third week because I went a week overdue. So that was my pre-labor. So then March 5th was here. My husband works nights, so he left at around 10 p.m. on March 5th. March 6th is our dating anniversary, so we had been together for 9 years this past March 6th. So I collected a bunch of photos throughout us dating and was going to post them with this gushy post about, we were dating, now we're having a baby, and cute stuff. I was peeing on the toilet, and it was just about midnight, so I was about to post the photos, and all of a sudden this liquid comes out of me, and I was like, I didn't just pee, so what is that? And then I look, and it's kind of cloudy, white, clearish, and I thought to myself, did my water just break? No, because that doesn't happen in real life very often. For most people, your water gets broken or your water breaks into labor. It's really only on TV and in the movies that it happens first, but it happened to me. So I decided to hop into the tub just to see exactly how much liquid was coming out, because I wasn't completely sure. But when I saw how much it was, I knew that it was definitely my water that had broken, which was really exciting because I was so ready to go into labor. So then I texted my husband and I said, 1, happy anniversary. 2, my water just broke. And then I texted my mom and we messaged my in-laws, and that was all around 12 a.m. So when your water breaks, your contractions don't necessarily start right away. So I had told my husband, there's no need to come home. You might as well stay at work. I'm not in any real pain yet, so I don't really need your help. I knew that it was okay for me to stay at home because we had asked my OB, in case my water does break, can I labor at home? Because that's what I wanted to do. I wanted to stay at home as long as possible. And he said that was fine. There's a test that they do to make sure, and mine was clear. So he said I had to come into the hospital by the 24-hour mark. Because once your water breaks, bacteria and things can get in contact with the baby, and the baby can get sick. So by 24 hours I had to go to the hospital, which obviously I figured wasn't going to be an issue. But sometimes your contractions take a while to happen, so who knows. I wanted to try to get some rest because it was midnight and I had been up for the full day. So I set all these towels on the couch and would try to lay down with the heating pad, because pretty much instantly my back started to ache. It didn't really hurt, but it was also pretty common for me at that point because I had a lot of sciatic pain throughout my pregnancy. So I kind of set everything up on the couch, and then I laid down, and after maybe 10 minutes, more water gushes out. So then I had to sort of stand up, more water gushed out, and then, take the towels, clean myself off, and then set it all up again and lay down. Well, that happened about 10 more times. So that got pretty annoying. I went through all of my towels. So after that, I kind of gave up on the idea of resting because my water just was continuously gushing out every 10-15 minutes or so. After that, I decided to just go through the different poses that I had practiced to manage pain, have a bath, have a shower, eat something while I can. So when my pains were getting worse, I would start it and then I'd stop it right away, just so I can kind of track when I was feeling more pain, even though there wasn't an obvious wave of pain like a contraction's supposed to be. So by 3 a.m. there was a more obvious pattern. I was getting to be in more pain, so I told my husband to come home, and he did. I tried to get him to sleep because I knew that I was going to need his full strength when things got really intense. I just kind of went through my pain managing poses, and he helped me with some back massage. By 9:30, my contractions had really progressed. They were quite painful. I couldn't really talk through them. They were 2 to 4 minutes apart. So I knew that meant it was time to go to the hospital. So we grabbed the hospital bag and headed over. I called previously so they knew we were going to be on our way sometime that day. So my husband dropped me off, and I'm just kind of waiting in the hospital front room. I'm so tired. And the contractions kind of stopped-ish. I was still in pain, but though that 2 to 4 minute mark kind of went away, which I've heard happens to a lot of people when they leave their, comfy home environment, which is why I wanted to stay as long as possible. So we got up to the labor and delivery floor, and I'm checking in, and I said, I'm in labor. And the lady goes, well, you think you're in labor. And I was like, I'm in labor. So after I get checked in, they take me to my room. I get put in the hospital gown. I'm laying on the bed, and I'm so excited to see how far along I am. I'm just so pumped to have this baby. And then they check me, and I'm only 2 centimeters dilated. And my heart just dropped down to my stomach. I was so disappointed. By the time my water broke, I was probably already 1 centimeter. So that meant that I had only progressed 1 centimeter in 10 hours of labor. I was really tired, obviously. By that point, I had been awake for 24 hours. But I was so upset about it. So they also found out that my waters hadn't broken at the bottom. So my water had broken at the top, and the water was just kind of trickling out, which is why it kept happening over and over again. So they broke my water at the bottom, so it was completely broken, and that was great because then the water stopped gushing, which was really annoying. So then my nurse had a little chat with me about different pain management techniques, like using the bouncing ball and going in the shower, and then also all the different options I had in terms of medication. She did say, you have been awake a really long time, and you're going to need a lot of energy to push. So if you think you can rest between now being 2 centimeters and, progressing to 10 centimeters, then that's fine. But I would recommend that you get an epidural so that you can get some sleep and be at your full strength when it's time to push. So I said, no, thank you. Right from the start, I really did not want an epidural. I was pretty clear about that. I think it was the first thing I said. They also decided that I needed to be put on Pitocin because I hadn't progressed and my waters had already been broken for 10 hours and we wanted to get things moved along. So Pitocin is a medication that makes your contractions happen, but it also just makes them stronger with the more that you use. So they decided that I needed that because my labor wasn't progressing, which meant that I was going to have an IUV, which was also disappointing because it just makes it more difficult to move around and do those different poses I had practiced, and things just weren't happening the way that I thought that they would, which everyone tells you. So I had planned to just have my husband and I throughout this whole laboring process. I wanted to have that intimate time with just the two of us, and I was very confident that I was going to be able to do most of it myself. So I decided to call my mom and tell her about everything that was going on, and I ended up just bawling my eyes out to her over the phone, and she said, maybe I'll just come over for an hour just to give you some moral support, bring Daniel some food, that kind of thing, because she knew that I didn't want anyone else there. But long story short, she ended up staying throughout the whole thing because I just needed her there. I needed her experience with having 4 kids and her wisdom in that, and it ended up being really helpful because it was such a long process. Daniel was able to rest, and they were able to tag team a little bit, and there were times where I really needed the both of them at the same time. Like, it was pretty intense. So after I came to the hospital, I had about 5 more hours of non-medicated labor. I went in the shower a lot. I think I was in there for a few hours, and that really helped with the pain. So once my mom got there, it was time to put the IV in. Now that was the second most painful part of my entire labor. I guess I have crappy veins or something, because when they were taking blood out, they had a really hard time as well. So they decided to bring the specialist in to put my IV in. Well, the specialist took an hour to put it in. I think they tried 4 or 5 different places after they already had tried 3 different places to take blood out. So I was being poked and prodded, and it was incredibly painful. And they ended up finding a spot in my bicep, of all places. So when that was in, the Pitocin kicked in, my contractions started getting stronger, and I decided to go in the shower, which was really great. I was in there for a few hours, and then after I came out, I said, you know what, I want that one medication that you mentioned. It's just a drug that makes you really loopy, kind of takes the edge off. I loved that. It made me a lot more comfortable. I was able to rest because by that point, I couldn't really stand anymore. I was just exhausted and in so much pain. So I could just lay on the bed and moan and breathe through my contractions, and I didn't have to stand. My mom was putting a cold cloth on my head, Daniel was holding my hand, and that worked really well. But then the medication wore off, and I was hoping that I could just have some more of that because that really worked. I was like, you know what, I can do this with that. But I couldn't have it for another 12 hours. So that wasn't going to work. So now I'm about 20 hours into my labor. They check me and I'm only 3 centimeters dilated, which means that in another 10 hours of labor, I only progressed 1 more centimeter, even with the Pitocin. So they obviously needed to crank it up more, which meant even worse contractions than I was having already. So then my nurse came and had a more serious conversation with me, saying, you know, I really think that you should get the epidural, considering the state that you're in and how much longer you have to go. What do you think? So I'm sitting there and I look over at my mom and Daniel and I look at the nurse and I'm like, I don't know what to do, but maybe. So she comes in and says, he's available in 5 minutes. What do you want? And I was like, I don't know. I was so against it. I really didn't want it. I was scared of it. I was scared of the effects, what it would do after, if it would have lifelong effects. You know, I was really not wanting it, but I knew deep down that I needed it to get through this process. At this point, just the way that things happened and the way that they were not progressing, I didn't think I was going to be able to make it, and I really didn't want to have any kind of emergency C-section or something like that if I couldn't push and things weren't happening. So I looked over at my mom and I just said, what should I do? And she said, Jess, I can't decide for you. And I said, please tell me what to do. And she said, I don't know. So then I look at Daniel and I said, what should I do? And he just looks at me and goes, you should get it. And him saying that made me kind of at peace with the decision. I already knew before I asked him that I was probably going to get it, but him saying that made me have the confidence to say yes and made me not feel so guilty about getting it, because getting the epidural to me made me feel like I was a weak woman, or that I wasn't strong enough to do this thing that we could do naturally. And it was a really hard decision to get it, especially after doing research with some of the effects that you can have. But it ended up being the best thing for me and my baby. The epidural was not bad at all. I was so stressed about it before, during, and it was a piece of cake. The only bad thing about it was that my husband and my mom did have to leave the room, which was a little scary, but the nurse came over and held my hand, and it wasn't bad at all. I didn't feel any pain, and it just felt a little bit funny. It just took a few minutes, and it started to work right away. It was crazy how much you can't feel, but then at the same time, you still do feel contractions. And that's one thing that surprised me about it. I thought that it was going to be 100% numb, not feeling anything, and that wasn't the case. I could still feel when things were happening. It was just way less than it was before. Like, completely manageable. You can sleep through it. So with the epidural, I was able to sleep and rest. They woke me up to check me at one point, and I was 5 centimeters. Right around that time, something weird happened to me where I could feel this urge to push really badly, and obviously I was only 5 centimeters, so nothing was gonna happen, and that was really uncomfortable, but it wasn't painful. It was just super annoying, but I was able to push past that and sleep. While I was resting, they did have me move from side to side because Landon was facing the wrong way and they wanted to get him flipped. So they would lay me on my side and put this big ball in between my legs. When they did that, the side that was raised, I would be able to feel everything because the epidural kind of fades down. So if I was laying on my right side was fine, but I could feel everything on my left. So I could feel the contractions happening just on my left side. So that was pretty painful and weird. But obviously I wanted to get him flipped, but at the same time, the whole reason for me getting the epidural was that I could sleep. So I would endure it as long as I could, and then I'd say, can I please go on my back? I'd be on my back for a while, get some more rest, and then they'd flip me on the other side. So when I got my epidural to when I was ready to push was another 12 hours of labor, 32 hours total. by that point, it was March 7th, which was the day I was supposed to be induced. So my OB was in, and that was really exciting. So when they realized I was 10 centimeters and we could get everything ready for me to push, they sat me up and they reduced the epidural so that I would be able to feel myself push and feel the baby coming down. They put my feet up in like the straddle position and they laid me back, but I had these bars to grab so I could like crunch up to push, which I did really like. But overall, I hated pushing, and not because it was painful. I didn't really find it painful at all. It was uncomfortable, but I didn't find it painful. But I hated the fact that I was supposed to hold my breath while exerting myself. Was just so weird, because through the whole process of me having contractions, I was just breathing through them, and I did a really good job at that. So then when they're trying to teach me how to push and I'm trying to like, they were like, no, you have to hold your breath. And then when I would hold my breath, I'd hold it in my face, which is wrong. You're not supposed to hold it there. So I felt like I was just so bad at pushing. I would have like my mom, Daniel, all of these nurses like saying, oh, that was a good one. Do that one again. One more. And I'd be like, you're all lying. I'm terrible at this. This isn't going well. Timing when I was pushing was the weirdest thing ever. I don't know how it all worked, but I felt like I had only been pushing for about 10 minutes, but that I was doing a really bad job. So it was going to take another like 2 hours. I kept thinking to myself like, oh no, this is so hard. Like, I don't know if I can do this anymore. Like, I can't do this for another 2 hours. It's only been 10 minutes. But in reality, it had been almost an hour. Like, I pushed for almost an hour. But it felt like just a few pushes had gone by. It was really weird. So they brought the OB in a little bit early because Landon's heartbeat went down a little bit while I was pushing. He ended up being fine, but it was just a precaution. So my OB was actually in there for probably 20 minutes instead of just at the end. So I got, so Landon's head was coming down. So they hiked up my feet like really, really high. And it was funny because I felt like I was being flipped upside down. But I wasn't. I don't know why I felt like that. But Daniel, who really didn't want to see any of that go down, ended up having it like right in his face, which I think is kind of funny. So then his head was like crowning, and they asked if I wanted to touch it, and I was like, no thank you. And then they asked if I wanted to see it with a mirror, and I was like, no thank you. So then I guess his head came out, and I couldn't really feel the difference. Like, I remember at one point saying, oh, I think his head is down. And they were like, yeah, his head is down. But I couldn't feel the difference between like him crowning and his head being out. There was no difference for me in that. But then Landon had massive shoulders. So my doctor actually had to put his hands in there and pull his shoulders out, which is probably what gave me the 3rd-degree tearing on the inside. But after he pulled him out like that, he just came right out. They put him on me, and he was so cute. His eyes were wide open. He was crying really loudly. He had really good lungs on him right from the start. I could see right away he had this like really cute little chin, and he was just looking at us, and it was the most amazing thing ever. I love that Daniel and my mom was right there. My mom cut the cord, and it was such a great moment. But it was really just for a moment. The thing that hurt the most throughout my whole labor was they were pulling these clots out of me. Daniel said there was just so much blood. They were all moving really fast, pulling these clots, and then the nurse was doing that like stomach pressing thing, and that hurt so badly. I was just asking them to stop. I couldn't handle it. I kept trying to look at my baby who's just laying on my chest, and I couldn't. Like, it was so painful. And then they were stitching me up, and there was no general anesthetic, and my epidural had completely worn off, so I could feel all of that, and I just kept begging them to stop, and obviously they couldn't, but it hurt so unbelievably bad. It was brutal. But then once they were done, all of that pain went away, which was great. So then postpartum for me was pretty rough. Obviously, I had gone through 34 hours of labor, which is pretty intense. So my body was just so broken. I was a mess. That first day or so, like, I don't really remember any of it. I wasn't there for Landon's first bath. I wasn't, other than feeding him, which he did great and right away, and some skin to skin time, I didn't even hold him or really look at him much. And if you look at pictures of me, like, I am so swollen because I ended up being on fluids for 45 hours because I didn't take it out until just a few hours before I left the next day, and it was just brutal. I bled a lot. I was obviously in a lot of pain because I tore very intensely, and my hips were in a lot of pain, and it was not a fun time. Looking back on it, I wish that I had stayed in the hospital for a few days, just not to learn how to take care of the baby, but just because I was in so much pain. So the intense pain, swelling, and bleeding lasted for about 2 weeks. I did have the baby blues on day 3, where you just cry uncontrollably and you just feel awful, slightly hopeless, overwhelmed. And then it happened the day after my milk came in as well, which my milk came in day 5, so day 6 was pretty messy for me. But after that, things went pretty well. I was obviously very sleep deprived until Landon was about 2 months, and then he started sleeping through the night. And once he started sleeping through the night, that's when things really got better for me, to the point where I felt normal again. Before that, things did get better, but they weren't at the level where I felt like I could do anything except take care of my baby. Landon is 3.5 months old now, and he is just so great. He smiles so much. He's such a sunshine. Everyone just adores him, and I would do it all over again 10 times just to have him. He's the best baby, and I love him so much. Thanks so much for watching this video, and if you want me to make more videos, possibly about having a newborn or more about postpartum, just let me know in the comments below.